This is Smooth Health on the Drive. All right, it is 16 minutes gone past 5, and you're tuned into the smoothest dial on radio, Smooth 98.1. All right, it's time for us to talk about our health on Smooth Health, and today is definitely going to be an interesting session. So if you need to go tell anyone, well, do that quickly. Go tell your friend to tell a friend to tell a friend to come through, as we're going to be discussing something very important today on Smooth Health. And yes, what are we going to be talking about? We're going to be understanding sexually transmitted diseases. We're going to be, debunking some myths, as well as putting out some things clearly in plain terms for you to know. And my guest this evening is none other than Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good evening, Dr. Ajayi, and good to have you.
Good evening, Joy. Thanks for having me.
Great. So Lagos, come through with your questions. Yes, I'm sure you would have a ton of questions, especially with this interesting conversation that we're going to be having this evening. And hey, all those myths you've also been having that you probably weren't sure about, well, we will be debunking them as well this evening. So come through and ask all the interesting questions you want to ask, and I'm sure that Dr. Ajayi will be available to, address them as we go. So talking about STDs, I know that in clear terms, these are sexually transmitted diseases, right? As much as I know that you will be giving us a breakdown of what they are, how often should one actually get tested for them? But let's start off with you explaining in clear terms what sexually transmitted diseases are.
Sure. Again, thanks for having me. This is an extremely important topic for worldwide, but especially for Nigeria. I'll give you some statistics about STDs. STDs, or sexually transmitted diseases, that's what we call them in the States. In Nigeria, Europe, they call it STIs, which are sexually transmitted infections. Okay. Both the same thing. They're just infections that are passed from one person to another through sexual contact. So that means vaginal, anal, and or oral sex, all include. So any infection passed through these contact through this, what we call sexually transmitted infections. Some of the common ones are chlamydia, or they used to call it the clap. I'm sorry, chlamydia, gonorrhea, which was called the clap. Okay. Syphilis, HIV, another one called HPV, or human papillomavirus.
Right.
Hepatitis B, and chancroid is another one that we see. But the ones I see every day in the clinic here, right. HIV, hepatitis, HPV, which causes genital warts, syphilis, gonorrhea, and chlamydia. We see those often. Okay. When we're talking about HIV,
right,
it's estimated that almost 2% of adults 15 to 49 years in Nigeria, which let's say is about 2 million people in Nigeria living with HIV as of 2022. Okay. And when you compare that to the U.S., it's only 1.2 million. Now, Nigeria has far less people. U.S. has over 300 million. Nigeria has just over 200 million. Yet, even with a lower population, our HIV burden is higher. It's a critical public health issue. So, and that's just not HIV. That's other STDs. So this is an excellent topic to talk about. When you're talking about testing in the U.S. or even awareness, which is why I love doing these programs with you guys, because it increases awareness for everybody. Right. Only 67% of people in Nigeria even know that they have HIV.
Oh my word.
And another, for in the U.S., that's 85% of people know they have it. So meaning that 33% or a third of people with HIV in Nigeria have no idea that they have it. So of course they're not getting treatment and they're not protecting themselves or others, which is extremely worrisome. When you look at the youth in Nigeria, ages 15 to 24, that accounts for 50% of all new sexually transmitted infections. All the new infections every year come from that population. 50% of them come from that population, even though they only represent 25% of the sexually active population. Right. So yes, this is important for people of all ages, but especially, the young ones listening need to really take note. So you asked, the second part of your question was asking about frequency of testing.
Right. Yeah. Especially, like you just mentioned, so we have younger ones who are experimenting, or you have people who are just getting into relationships and the like. So, it is actually a good one to know. Am I supposed to be testing with each partner that I'm getting with, or is there a certain time that I'm supposed to be testing?
That's an excellent question. I like to do textbook statistics and then what I actually practice. In the textbook, it tells us in sexually active people, especially those that have multiple partners, should get tested annually, right? That's every year. And we'll add some practical nature in there because you mentioned something that was important. Every time you get a new partner, it's important to get tested. Important to get tested for you and the partner. And I'll just remind people out there, just because somebody says they're clean or says they were tested or said it doesn't matter. Just because you looked at the genitals and you think the person looks quote unquote clean, that means absolutely nothing. Absolutely nothing. That even if you're clean looking or you don't have symptoms, what we call asymptomatic, or meaning no symptoms, you can still have the disease and you can still transmit the disease. And that's any of them. Oh, wow. That's any of them. Genital warts, HIV, syphilis, chlamydia, all of them can be transmitted by people that are not showing signs of the disease. So it's a very important. New partner, get tested. You're sexually active, get tested every year. Right. If you do risky behavior, multiple partners, what they call extra risky, right? Multiple partners, what they call high risk group. These are people that either are in sex work, or like porn actors. In the U.S., porn stars get tested every 2 weeks. Okay. And they have to show, that's 25 times a year. They have to show the proof of testing before they can get on any movie set. And since they went to that, they have only one documented case of HIV transmitted in the last 10 years, which before it was a lot higher. My recommendation for people here is every 3 to 6 months, if you're in the high risk, meaning you have multiple new or multiple partners, men who have sex with men, or those that have a partner who has an STD. For example, I have some people that are married. One person has hepatitis B, the other person doesn't have hepatitis B. And if you've not been treated and tested and done the right thing, yes, then those kind of people should be tested every 3 to 6 months, just to make sure that they have not transmitted. So good question and extremely important.
Thank you so much for, giving us that statistics, because that's actually worrying. If you just think, oh, okay, so walk in the park, I'm good. As they say, it doesn't show on the face, doesn't show body-wise, because people will assume that, oh, okay, you look healthy, so you're good to go. But thank you for, pointing that out. Okay, so
one little thing I'll add very quickly.
Go ahead, please.
Diseases have something called an incubation period. So if person A that has no disease has sex with person B that has a sexually transmitted disease, and person A goes and gets tested 3 days later, and it's negative, that does not mean that you're covered, that the sex that you had 3 days ago was okay. You have to test yourself again, because it may take, if it's, for example, HIV, the test may not be positive for a month.
Oh my!
For some other ones, some of them, especially the bacterial one, it may not be positive for 2 weeks. So imagine now if you have multiple partners or you're engaged in risky behavior, you now have sex with somebody that has an STD. You get tested in a week, you think you're fine, and you now continue that behavior with other people. You can easily be passing along a newly acquired STD. So just because you have a negative test on a Monday and you have sex on Tuesday, doesn't mean that it's going to still be negative on Wednesday, and you have to retest yourself because it takes time before these tests become positive in the body or in the urine or in the bloodstream.
Well, that's actually, very important information there. So it is not something to just overlook and just say, oh, okay, I've done my testing today, so that means I'm good. Just make sure that you are consistent and making sure that you're also not doing things that you shouldn't be doing. Okay, so more or less, I know some STDs have signs and symptoms to look out for. I know that some you mentioned genital warts in some situations, but how can one even figure out if they have an STD? I've heard that sometimes it's probably when you're itching, or probably when you've gone to the urinals and your pee is having some effect on you.
Right, burning,
all that burning sensation. Yeah. Well, I'd like you to also help us understand the signs that we need to look out for when one thinks or should assume that they have an STD. However, bearing in mind that I know that, yes, once you think you have something, go to the hospital and see your doctor immediately.
The early signs of STDs, they can vary based on the STD, but some of the ones that I see often are unusual discharge, whether that's a vaginal discharge or a penile discharge. What you mentioned, pain with urination or burning with urination.
Right.
I see sores, like wounds or bumps on the genital, right. And itching is also part of it. Some other ones can include pelvic pain, bleeding, and of course fever because it's an infection. Ooh, but okay. I'm going to repeat it again. It's very important to know that a lot of STDs are asymptomatic, or meaning no symptoms.
No signs.
No symptoms, so you cannot rely on these. But if you were to have an unusual discharge, pain during urination, pain during sex, bumps on your genitals, or itching, of course, you need to come and see your doctor as soon as possible. But you may not see any visible signs, and the disease can still cause very serious health issues. So it just reminds us that it's important to get regular testing if you're going to engage in sexual activity.
Very scary when you put it that way, but if you love your health, you should also be doing the things that are right, so you're not...
women, sorry to interrupt you.
Go ahead.
Women in Nigeria, and in other countries, but I'll give you Nigeria statistics, they're twice as likely to contract an STD than men. And it's important to know that because I see the patients, almost every day.
Okay.
Some women are doing it. They're looking at the man's penis. Is he clean? Did he tell me that he's fine? Did he tell me, and believe in it? And the reason why they get it twice as likely as men is due to anatomy. Women have a very short urethra. That's the tube that empties the bladder for urine. Right. Men have a very long urethra. So it's harder for men to get infected, some of these infections. And then women have openings that can get affected during sex more than men, especially during heterosexual sex. So it's just important to know that women are twice as likely to be affected. And some of them, like HPV, that's called human papillomavirus, it causes genital wart. Some of them, some of them can cause, like HPV can cause cervical cancer, right?
Okay.
Cervical cancer, can be caused by untreated HPV. HPV is the number one most commonly sexually transmitted disease. And cervical cancer is the second most common cancer in Nigerian women. And it 23 out of 100,000 die from it, and 33 out of 100,000 have it. And so these statistics are important to know that these are not small pockets of people. This affects can affect everyone. Exactly.
Okay. Well, I have a question here from Ali, and Ali says, it says that there are people who say that they are on PEP or PrEP, and they stand by the notion that they can indulge with an uninfected person and won't infect them. How true is this? Also, he says, are there long-term side effects of people who are using this medication on their organs?
That's an excellent question. So, what people, let's define it for the listeners: PEP or post-exposure prophylaxis, and PrEP or pre-exposure prophylaxis. So, prophylaxis means you're treating a disease before you have diagnosed the disease or before the person is positive. For example, one like this person's example, somebody may be on what they call antiretroviral therapy or HIV medication, and they don't have HIV, right? And they don't have HIV, and they now think that, because I'm on the HIV medication as pre-exposure prophylaxis, I'm safe to have sex with anybody, whether they have HIV or not, because I can't get it.
Okay.
Right. Post-exposure is I may be infected with the disease, but since I'm on the medication, I can't infect anybody else. And that is just absolutely false. That's not how it works. All these drugs reduce your chance of gaining the infection or passing the infection along. Yes, some of them can even reduce it significantly, but it's not 100%. So there is still that chance that you can infect the other person. Yes, or that you can be infected. So when some of these, the most important thing to know, I think we'll talk about cures and treatments and stuff, but a lot of these diseases do not have cures. They only have management. And a lot of them can shorten your lifespan significantly. So it's like you're taking this drug thinking it's 100% and you're just playing roulette with your life. You're just playing with your life. At any time, one of these sexual interactions can still give you the disease, still shorten your life and put you in an early grave. So I would not want to risk my own life on those kind of numbers. But that's a very good question.
All right. Well, I'm sure that Ali has gotten his answer so far, and we'll be better informed. Okay, so now let's go ahead.
Another thing, just to buttress on Ali's point, another thing I see a lot is people will have risky sex or sex with somebody they don't know and this and that, then run to the pharmacy and take a couple tablets to just wash the system. That does not work. That does not. You can't just take some tablets for a day and think that, the sex you had yesterday is... Yeah, it sounds funny to you, it sounds funny to me, but it is... I see it all the time.
Oh, my word. Okay, interesting. Well, that's why I have the doctor with me to, debunk all this myth that people usually have and put things straight. And talking about misconceptions, right? Let's even get into misconceptions about STDs and transmission. You've already touched on it a bit. So, what other misconceptions are there regarding STDs that one needs to know? I definitely want them clarified, especially when it comes to herpes, or like you've just debunked that of HIV and you being on medication and thinking that, once I take a medication, I'm good. I've also heard where some individuals will take... maybe they've just, engaged in some sexual activities, and then the next thing they're taking some antibiotics, which are so, antibiotic reactions to body and things. Well, that's on another that's another conversation we'll be having sometime in the future. But now let's even talk about those ones that you just see them run to the pharmacy and say, "Oh, I want so and so and so and so, and I'm taking it to prevent or protect myself." So are these things that people should be doing, or are these habits safe? Because the whole idea behind it is, once I take this medication, I am protecting myself and I'm in good standing.
Very good. I'm going to take it kind of in reverse order because I remembered Ali asked the second part, which is what are the side effects on the organs? And
right.
one of the myths is that, I can run and take this. Usually it's an antibiotic. Take this antibiotic. I know the name of it. I'm
intentionally not mentioning any either.
But they'll go and take this antibiotic and clear the system. Right. Number one, antibiotics don't work that way. Most of them don't work in single doses. There's a few, but it's not for most STDs. Number two, a lot of the infections we're talking about are viral. So antibiotics have no effect on viruses. Those would be antiviral medications. Now, either one of them, antibiotics or antivirals, all have side effects. Everything has side effects. Some of them are as simple as stomach upset and running and diarrhea. Some of them can cause erectile dysfunction. Mm-hmm. Some can cause liver damage. Some can cause kidney damage. Mm-hmm. All of these things are serious side effects. So you wouldn't want to be taking these medications if you didn't have to. And you definitely don't want to hide behind them thinking that there's no risk to taking them. There can be a lot of risks. Right. Another major misconception is that STDs can only be transmitted through penetration, right? And that is just absolutely false. You can be transmitted through oral sex, anal sex, and even close skin-to-skin contact, especially when we're talking, remember I said HPV, the virus that causes genital warts? Mm-hmm. It can be transmitted by skin-on-skin contact. Right. So, and it has no cure. And it is the most commonly transmitted sexual disease worldwide. So just rubbing genitals without penetration can give you a disease that has no cure, right? And we also mentioned that HPV caused cervical cancer in women, second leading cancer in Nigerian women. So these are all risky behaviors that you really don't want to do if you value your life in any way.
Right. Stay away from risky behaviors.
Yes, please. Another very common myth is that condoms offer 100% protection.
Oh, wait.
It's not true.
Oh, my word. Now you're breaking a lot of people's hearts because they already assume that. Or they've always had this notion that once you have a condom on and that's it, you're protected. So whatever else happens is by the way. But now you're saying it's not a feel-safe kind of situation. Please, enlighten us.
Absolutely not. Yeah, well, I'm not saying people should not use condoms. Condoms are very, very good. They reduce the risk significantly, right. But they cannot eliminate it entirely. Especially now, we just talked about HPV. Also, that's human papillomavirus. Also, herpes virus. Both of them can be transmitted through skin-to-skin contact.
Right.
So, condoms shift, condoms move, and condoms don't cover your entire skin. Mm-hmm. So, at times, you can have skin-to-skin contact, and things like HPV or herpes. Remember, they don't have any cure. But both of them don't. You can still be transmitted. I even want to add an anecdote. I have, I know a young lady, Muslim, did not have sex until she was about 30 years old, had sex once, and developed genital warts. A few months after. Yes, I had to laser them off in my theater once. And this is somebody that I know for a long time. But had sex one time, now has genital warts for her life, the rest of the life. There's no cure. So yeah, I can burn them, I can laser them off in the office. You may not see them. You have to put them on medication. You can manage the disease, but there's no cure for it. And I just feel so badly for her because she was lied to by the partner, the young man in question, by the partner. So. If we can save even just one person from that, that's extremely important. That's another myth, that you can't get an STD if both partners are clean. They look clean. Like we said, being asymptomatic or having no symptoms is common in a lot of these infections.
Right.
The one I hear 1,000 times is that you can catch an STD from toilet seats.
I was waiting for you to speak on that one because the myth around that, just from the toilet seat, how? But hey, I can have you to share.
That myth has caused a lot of breakups, I can imagine, whether it's boyfriend, girlfriend, or husband, wife, because I've had people in my office with a discharge. We have to treat. And I'm asking, have you engaged in this? No, doc. I used the toilet at this restaurant, and I'm very sure that's where I got HIV from. No, I'm very sure that's not where you got HIV from. I'm very sure that is more than likely the unprotected sex you had, or you can even get it from blood transfusions or something like that. But very rare. It's not a fact that through contact with toilet seats, you'll now get an STD. That's just not how it works. Bacteria and viruses, that the most common ones, don't really survive that long outside of the body. And life on a toilet seat is not the best life for a bacteria or a virus. So it's very, very unlikely to happen.
Okay.
I have a couple more if you want a couple more.
As much as I'm guessing that would probably have a part 2 of this, but I want to actually touch on something that you spoke about earlier on, and has to do with reproductive health. How does STDs impact reproductive health, especially for those who does it affect the fertility of this person, or could it have a negative outcome for someone who's pregnant, or could it affect them in general?
I like to say that I've become an infertility, let me say erudite. I don't know if I'd say expert. I don't like to talk about myself, but I've become an infertility because I see so much of it in practice here that I'm forced to treat it. I've now enjoyed, making change in patients. And what's unfortunate that very few people understand that STDs can have a significant impact on reproductive health. So let's start with women. Untreated STDs or poorly treated STDs can cause scarring in the fallopian tubes. Those are the tubes that carry eggs from the ovary into the womb.
Right.
And you only have 2, one on either side of your body. And if you have an untreated STD, number 1 is chlamydia, number 2 is gonorrhea in this country, can cause those fallopian tubes to be blocked. That person is now infertile. I mean, there's almost no way you can get pregnant if you have blocked tubes. Or it increases your chance of getting a pregnancy in the wrong place, what they call a tubal pregnancy or ectopic pregnancy, which is a surgical emergency. You've heard of those before, right?
Right, yes.
So not only can the STD cause you to be infertile, can also cause you to run the risk of having an ectopic pregnancy, which requires a life-saving surgery. Half of the people that do ectopics in this country die. So also pregnant women that have STDs have the risk of passing the infection to their babies, which can infect the child, can also cause preterm labor, can cause low birth weight, can even cause stillbirth, And there's some infections that affect both the mother and child severely in this country. Syphilis, herpes, and HIV both have significant effects, serious effects on the mother and the baby. So if you're asking, do STDs impact reproductive health, fertility, even pregnancy outcomes, the answer is yes, 1,000 times yes. And it's painful when, you see a man and a woman newly married, try to have children for 2 years. You now see the tubes are blocked, and you try. There's nothing you do to open it. So now having a child has become extremely expensive because now you have to do IVF. IVF oftentimes is only 30 to 40% effective the first time. IVF in this country is easily 2 million naira or more. So and you may not have to do 1, 2, 3 cycles. So you're talking about 2 to 6 million naira before you have one child, which is out of the reach of so many people. So this is something that's a good question too. Something to put some emphasis on.
Well, as much as it hurts me to actually say this, but we're out of time. But you know what? I'm hoping that we can have a second part of this conversation because there's so many things that we haven't touched and we need to, have conversations about. So I'm hoping that next week we can have a part 2 of this.
If you invite me, I will definitely be there.
Okie doke. So thank you so much. And I'm sure Lagos would be itching to get in here and have all their questions ready as well. I actually see some people.
Hopefully not itching. You mentioned that. Hopefully not itching. but they can be eager.
Yes,
and
please be eager, but not itching, please. Well, thank you so much, Dr. Jai, for giving us all this insight so far today. Yes, we'll go again next week, and we'll have a part 2 because there are certain questions that have not been touched, and we'll get to know more when it comes to STDs. Talking about management, since there are some that are not curable at all, so we'll be touching on that when we go next week. But thank you so much for sharing your time today and sharing all those insights. I trust you have yourself a pleasant evening.
Yeah, I'll also put some resources on our social medias, ROA Specialist Hospital, on all the ones that matter: Facebook, Instagram, Twitter, and people can engage me there until I see you next week.
Okay. Thank you so much for, your time. And Lagos, thank you so much for coming through as well. And I'm sure you've learned a thing or two about STD. So we'll have a part 2 of this conversation next week. So don't go nowhere. Stay tuned to Smooth 98.1, where we definitely share everything regarding your health and indeed making sure that you stay healthy. But on the other side, so much more music lined up for your listening pleasure. So don't go nowhere. Stay tuned to Smooth 98.1.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Yeah, we started last week talking about sexually transmitted diseases, and you know what? We're following up on that today. So you can come through and ask your questions. And this time around, yes, send every question that you have regarding STDs that you want to have answered, and Dr. Biola Ajayi will be here to, tackle them as best as he can without making you feel uncomfortable, because I know that that's one of the things most people find very difficult to, ask questions while they're feeling uncomfortable about asking those questions. But if you don't ask those questions, hey, you just might be leaving with something you shouldn't be leaving with. Okay, I know that last week we talked about what STDs are. We touched on certain things regarding, we spoke about how often one should get tested. We also spoke about early warning symptoms or signs to look out for. Some misconceptions as well about STDs. Even spoke about, certain things or how treatment options that some people would opt for without realizing that it's not the correct treatment, and how it could also cause more damage and harm to their body. But today, we'll be, like I said, falling through and talking about more interesting conversations today. So,
as you said that, right, I want to interject something that I've seen.
Please go ahead.
And let's have this as the next topic, maybe. Okay. There are a lot of people out there that think that when you use this, I can say these drugs after sex. Some of them start with the letter P. The two most favorable ones start with letter P.
Yeah.
Right? And our listeners can know it starts with letter P.
Right.
Right?
Right.
And some of them have the letter 2 in them, right? So that's all I will say.
Okay.
But I have 90% of my people thinking that is part of family planning. And it is not. Those types of tablets, what they call the morning after pill in the U.S., that is called emergency contraception.
But you find them using it every other time that...
Yes.
It's not...
And the problem is, you know who I'm hearing these stories from? Women that are having trouble getting pregnant.
Oh, my word.
Right. So
it is something to actually have a conversation about.
Yeah. So I think we should have that conversation.
Why infertility is really on the high. But hey, if we don't have those interesting conversations, who else will?
Right.
Right.
Ignorance. That's why we started this journey a long time ago on a different radio station. But
I know, right?
the mission is the same: educate the public.
Indeed, it is to give you all the education that you need, and on a easy platform as well. Basically, radio just makes it easier for you to just access it and get all the information.
You have the right host.
Right.
Okay.
Okay.
I'm not going to tell anybody on the air anything, but if you have the right host, it's fantastic. Let me tell you that.
Thank you. Now I'm blushing. Okay, let's deflect from me and get to hear from you today. So let's even backtrack and talk about treatment options for STDs. I know that there's some that you actually spoke about last week. However, are there also emerging trends in the treatment of STDs?
Yeah, so, when you ask that question, what are treatment options? I want to answer it very basic, then I'll circle back.
Okay.
Very basic. There are some STDs. STD meaning sexually transmitted diseases. For those listening that didn't listen to the last program, you have sexual contact with a person, whether it's oral, anal, vaginal, or direct skin-to-skin contact.
Right.
You can acquire a sexually transmitted disease. And the thing to know is that some of them have cures. Some of them have treatment options that you can live with and be happy with. Like, I'll take this, I'll be miserable for 2 weeks, but I'll get a cure. But there's a large majority of them, and including the number one, human papilloma virus, HPV. Right? So the same sexually transmitted disease that causes genital warts.
Yeah.
Has no cure. Has no cure. So we can talk about treatment options, and the treatment options for that is trying to manage it and reduce outbreaks and keep you from infecting your partner and hoping you don't transmit it to your newborn. And yes, that's what it's centered around. But can you imagine having a disease that you could cure? Like, I got this in September, I cured it in December, and now I don't have to worry about it because I'm not going to engage in risky behaviors.
Indeed.
So there are a lot of these diseases that they just don't have any cure. So we have to start there. But there are treatment options. The bacterial ones, like chlamydia, gonorrhea, they used to call it the clap back in the day, syphilis.
Right.
Yeah, they can be treated with antibiotics. As long as you take them for long enough and you take the right antibiotic and the right person did the culture, between 2 to 4 weeks, you solve it. But we have viral infections that you cannot see. You can't look at somebody and say, you know what? This guy looks clean, but you can't see viral infections. You can't see bacterial infections in 70% of the population.
It's just like when they say you can see AIDS doesn't show on the face, HIV, you can't actually tell just by looking at a person that person has the virus. So
you're exactly correct. So viral like herpes, HIV, like you mentioned, they can be managed, with antiviral medications, and you reduce symptoms and stuff. But and those management, they reduce severity. If you have a partner that has this and is listening, there's hope. There's things that you can do to reduce the transmission, but you don't want to get in the first place. You don't want to get it. So
prevention is better than cure at the end of the day.
God bless you. So, there are treatment options for bacterial ones. There are a lot more treatment options for viral ones. There aren't any for most of the ones we're talking about. We just think that we can manage, but it can significantly improve your lifestyle. And I give anecdotal lifetime that I have a patient that got married.
Yeah.
This was only her second sexual encounter, but her first sexual encounter gave her genital warts, even papillomavirus, all over her female parts, and that was only from one encounter.
Just one.
That's one. There's one, and I believe her when she told me it's just one. So it's painful. I just wish everybody knows the risks that they're taking, and then you're not making an informed decision.
Right. Now, talking about that, right? I know that every day we, in science and in the medical field, there are emerging disease that we don't even, the lay person doesn't even know. But in that space, are there new or emerging STDs that could be of cause for concern? And what could be the implications for the general public, for those who don't even know that there are things like that?
As often as I do, I want to take your question in reverse order.
Okay.
The most important part of your question is, what are the implications for public health, or what are the implications for the general public?
Right.
They are diseases, like we've talked about gonorrhea, which we've nicknamed the clap. I didn't nickname it. It's been nicknamed that forever.
It's been that way for a bit now, yes.
Yeah. And in the 70s, they had a treatment for it. But what happened now that we're in it's become resistant. There's even something called super gonorrhea, where what you knew, it's the same bacteria, but what you knew in the 70s and 80s and 90s to treat it now does not treat it. And we only have a limited number of antibiotics. We have a limited number of antivirals. We have a limited number of treatments. Right. So if you get a strain that is resistant, or what they call antimicrobial resistant, then you're, I won't say the word, I want to say you're up the creek without a paddle. You're just in trouble. So one of them is Neisseria gonorrhea, or people call it gonorrhea. Other people call it clap. And another one is called Mycoplasma genitalium. That's one of the newer ones. And Mycoplasma is the same family as TB, tuberculosis.
Okay.
It's a nasty type of, let's use the word bug. It's a nasty bug that has a slime coat. It has so many advantages against other bacteria that if you get infected with it, it can stay there, it can last, it's hardy, and it can do all kinds of damage, So the public health implications of these, we've not really, put our hand around in Nigeria, but if we now look at the causes, we eliminating that risky behavior, whether it's stuff or these new things we're talking about, you can reduce your risk for all of them.
Interesting. The major thing is you actually want to just reduce whatever behaviors you're having that could put you at risk, because when you hear things like it's going to be somewhat permanent in your system, even if you think you have all you can do is just use some medication to relieve the pain, just like you made mention of the patient earlier, that just one time and she has genital warts, and the only thing she can do...
Genital warts have no cure.
They don't have
no cure. So I lasered them off in the theater.
But eventually they come back off. They come back eventually.
They can come back anytime for the rest of their life. There is no known cure for them. It's just miserable.
Now, that indeed is why they say stay away from risky behavior. Okay, while we're staying away from risky behaviors and still trying to keep Lagos abreast with their health and be in good shape, what are the specific health risks that are associated with STDs for men? And this time around, I'm talking about men, because it's usually I find that most of the time you find most women are concerned about their health, so you find them go to the hospitals more regularly than men. But now let's talk about the men. What are the health risks that they could find themselves guilty of, and how do they address them?
One of the reasons why you would ask that question, what are the specific health risks associated with men and STDs, is because a lot of men will not show the symptoms. So we've mentioned gonorrhea multiple times on this thing. We call it the clap. 70% of men will not show symptoms. The women will show symptoms, but 70% of men will not show symptoms. So that's why it's even more important that, you could be a man, you could be infecting multiple people. Right. And those health risks that are associated with an untreated STD in a man can cause something called epididymitis, which is just pain, swelling in the the scrotum area or the testicle area. Yeah, the pain and swelling could be treated if it's identified in time. I had a patient today that had that pain and swelling up and on for 4 to 5 years. And now I'm just meeting him today for the first time. And after I did all our tests and everything, it looks like that his fertility has been reduced to almost zero because of untreated or improperly treated STDs. And this is a man. He had pain, swelling, infection, swelling. And he went to this place, they gave him the drug for 2 days. Went to this other place, gave him the drug for 3 days. But at the end of the day, he's 28, wondering why his, excuse my language, balls hurt. And I have to tell him that he's had infection. And now that he wants to father a child, when we check the sperm, there's nothing in there. There's no sperm. We check the semen, there's nothing in the sperm. And this can happen to anybody. Man, woman, anybody. These kind of things need to be treated. In HPV, for example, in a man, in human papillomavirus, which is the number one sexually transmitted disease in the world now.
Right.
In men, 80% of the time, they have no symptoms. The other 20% of the time, you see a genital wart. So if you're one of these women that takes the magnifying glass to go and look at the genital, only 1 in 5 times will you see anything that bothers you. The other 80% of the time, that man can infect you with something that can cause cervical cancer, which is what we call HPV. And the woman will suffer. And I saw somebody with cervical cancer just 5 days ago that didn't know she had cervical cancer. And you know her age? 30. She was 30. 30 years old with stage 4 cervical cancer. When I went to look, everything was bloody. The cervix, I couldn't even find. Everything was bloody. And it's painful to say that to a 30-year-old, 30 now, not a 90-year-old, a 30-year-old that, cancer has spread all over your pelvis. You are now going to need radiation, chemo, and your life has changed forever.
All right. We'll
definitely go back and trace it to HPV. It's very painful.
All right, let's quickly take this quick breather. On the other side, we definitely will continue the conversation. I see a question popped up, but we'll take that and more of your questions as well as the conversation on Smooth Health. Don't go nowhere, Lagos. Stay tuned to Smooth 98.1.
Funky fly, silky smooth, 98.1.
In a world where your health is your greatest asset, you can trust us to care for you and your loved ones. At Evercare Hospital, Lekki, we understand the importance of compassionate care and medical excellence. From routine checkups to specialized surgeries, our team of experienced doctors are dedicated to guiding you through every step of your health journey. At Evercare Hospital, Lekki, our state-of-the-art multi-specialty tertiary care facility delivers a wide range of services across core medical and surgical subspecialties. Experience compassionate care and cutting-edge treatment at Evercare Hospital, Lekki. Your health is our priority. Contact us today on 0813-985-0710 or you can visit evercare.ng to schedule your appointment. Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
Meals have a way of taking us on a journey. And when you add plenty of vegetables like efo, ugu, and season with the rich taste of North seasoning cubes, even better.
So, go ahead and elevate your meals with more vegetables and the rich taste of Knorr cubes. Today, eat for good.
This is Smooth Health on the Drive.
It's a global observation that helps raise.
This is Smooth Health on the Drive.
All right. right, it is 34 minutes gone past 5. Yes, you are still tuned into Smooth Health on Smooth 98.1, and we are talking about STDs and understanding it, as well as, just dealing with other varying angles to STDs, how it affects you as a person, man, woman, and how you can actually get treated for it. Not have to pass it on to any other person, and figure out how you can live the best life as well. And my guest this evening is Dr. Abiola Ajayi. He's the MD CEO of ROA Specialist Hospital. All right, and hey. Okay, Dr. Ajayi, you're muted, so I need you to unmute.
Okay. I listen to you.
All right, so I have this question here that's popped up. She says to keep her anonymous. However, she says, what can I do as a female who has boils regularly in her private part?
In her
private part. Her lady bits.
In her lady bits. I like that term. So if you asked me this question 2 years ago, I would have given you a completely different answer. I would say, oh no, we need to poke the boil, get some of the pus out, see what the bacteria is, and we'll give you an antibiotic for that bacteria.
Okay.
Right? And that's where I end my discussion. But I've now been following something called integrated medicine, which is how do you understand the root cause? Instead of just treating the symptom or just treating the boil, what caused it? Right, and I've been on that journey for 2.5 years, and I want to come back and talk about just integrated medicine. We're going to talk about supplements and diet and exercise and all this stuff that they didn't teach me in medical school. I had to go and learn on my own, but that makes all the difference. So for the listener, if she was walking into my office and she had a boil, yes, I would still lance it or poke it, get some of the pus out and see what bacteria was there. But when I see that bacteria, I'm not going to change her diet so that bacteria doesn't want to grow. Okay. Because we have a lot of normal bacteria in our body, but if you allow some of these other ones to grow, she may be on a medication that's allowing these other bacteria to grow.
Oh,
or she may be eating something in her diet, like a lot of carbohydrates or a lot of sugars, that's allowing these other non-beneficial bacteria to grow. So I may put her on antibiotics for a very short time, but the long-term solution is changing her diet and changing her lifestyle. Eat between this time and this time, don't eat these things. And do you know that can actually cure disease?
Apparently, just knowing what your body needs and knowing how to adapt to it is the best way to go, as opposed to just packing all the medication.
It's not giving somebody 14 medications. It's how do I solve the root problem with minimal medication as possible?
I know. Interesting. And I hope that I trust she's listening and will probably do the needful. All right, don't worry. I'm sure that at the end of the session, I'll share Dr. Abiola Ajayi's details so you can actually reach out to him if you have further questions on that. Anyways, let's get back into the conversation. Yes, we've touched. I can hear you. Yes.
Okay.
Yeah. All right. So the thing about STDs is we're speaking about it from the male perspective. Now, how often should one get tested for STDs if they are sexually active with multiple partners? Not one, but multiple partners. I know the first thing you would say is stop risky behaviors, but okay.
Look,
preach that.
I like to tell the truth. Stop risky behavior.
Okay.
Nobody should have multiple sexual partners because it just increases your risk for everything.
Right.
But if somebody is sexually active with multiple partners, they should get tested for all the common diseases every 3 to 6 months. It just depends on your doctor, and your frequency. But I'll add a little story.
Please go ahead.
In the U.S., people that work in the adult entertainment industry, these are porn stars, strippers, they, for an environment that I know, they get tested every 2 weeks. Every 2 weeks. And since they started doing that, the outbreak of AIDS went down to 1 in 20 years. And a lot of other things were short. I'm not saying go and have sex with everybody you want to and now get yourself tested every 2 weeks. That's risky behavior. But I'm just saying that, if it to that extent, every 2 weeks. But the number one thing to know is that you have a new partner, go and get tested together.
Okay.
Right? Go and get tested together and know your results. And then the fidelity, or AKA the infidelity, that's between the two of you. But if you feel like you're changing partners every month or every 2 weeks, check it every 2 weeks. If you have somebody in a committed relationship and you guys just want to have peace of mind, do it every 3 to 6 months. If you're married and 60, your wife's not even leaving the house and you're not leaving the house, then you still do it every year. So the least frequent is yearly, because you never know when something can come up. That's just how it is.
Interesting. And this, while this is wild as, I think I shall just hold my thoughts in on this one.
No, that's what this for.
Well, I think this one is a bit interesting for me, and has to do with adolescence. I know that in other climes, certain things are seen as negative, but when should adolescents start getting tested for STDs? And when I heard that it's a thing in other climes, I was surprised, because adolescents aren't supposed to even be knowing or getting involved in sexual activities. But hey, here we are, and it is a valid question to ask.
And I like that you walked right into that Nigerian stereotype, because I'm a Nigerian. I was born Nigerian parents. I did not get any sexual talk until the day before I was going to college. I was 17 years old. My mom looked at me and just said, there are girls out there.
Right.
And there's this out there. And you know that you shouldn't do this. And that was it. That was my...
that was your orientation.
That was my orientation. I went to college the next day. Thank God, I learned along the way what to do and what not to do. But to be honest, anywhere from 15 to 25 years old, we have to acknowledge the fact that represents 50%, half of all the new STDs every year. I'm talking about Nigeria.
Oh, my word.
So the people that exist between 15 years old and 25 years old represent 50% of all new STD infections every year.
Okay.
So that's the group that, if you can really, make a dent in, you'll see, big changes. And they're obviously a lot more sexually active without any knowledge. So instead of, the approach that we did back in the day, like send people to school with nothing, they really need counseling. They really need talk. And you don't leave it up to the school or leave it up to the pastor. No, you need to have this conversation with your children. Like, this is A, this is B, this is C. I don't mind coming back later and telling you the conversation I've had with my own children. But the earlier you have it with them, the better. Right. But I know the Nigerian way is just put your head in the sand and just pray. I raised a good child.
I'm not trying to trivialize that, but yeah, that is usually the stance. But
you see
we've gone beyond that. Pray and putting our head in the sand like the ostrich. The whole body's exposed.
But they represent such a high percentage of those that have STDs that adolescents should start getting tested as soon as they become sexually active. And that's a catch-22, because you're like, well, how would I know?
How would you know
that they're becoming sexually active?
Exactly.
And that's why the conversation needs to start early. That's why the conversation needs to start early. You have to build those avenues of discussion in with your kids. It's just no other way.
Right.
They have to be comfortable. Like my particular kids, they just turned 9 a month ago. As it is now, I know there's no way they can lie to me. But I need to continue that open dialogue, stay close to them, so that continues when they're not 9 years old, but they're 18 years old.
Right.
And that's the same thing for everybody that's listening. You have to have that open dialogue, and you have to let your kid know that you're free, you're open to the discussion without judging them, without admonishing them, making them feel bad. You're ready to just listen. And that's the key. This is Gen Zs and Gen whatever. You have to be ready to listen.
Indeed. Well, I don't even want to go into all that labeling.
Makes sense.
But you know what? We shall leave it where it is. Well, before we run out of the studio, I want to actually find out, are there any vaccines to prevent STDs? I know there are some for HPV, but aside that, are there any other ones that we should get to know of?
Oh, yeah, there are a bunch, and they're being developed and released in Nigeria every day. So I can't give you an exhaustive list, but you mentioned HPV. HPV is the virus that causes cervical cancer in women. That's the number 2 cancer in women. So you can do a lot to reduce that with a vaccine. Hepatitis B has a vaccine. There's 3 shots over the course of 6 months.
Right.
And I see hepatitis B more often than I see any of these other, even in my practice, more than I see chlamydia and gonorrhea, which have cures. So there are vaccines. I think the main point, which I'll end with, is that don't be afraid to talk to your doctor and identify any risky behavior you have, or you have a symptom, pain or discharge it. The sooner you expose it, the sooner you get the solution, and the less the complication. And if you need help with that, ROA, specialist hospital, and any social media, anybody mention 98.1 Smooth FM is free. I just like educating the people. And I like joy.
Thank you so much. Okay, well, we've had an interesting session today, and as always, it's my pleasure to have you come through and educate us while making it making it light enough for us not to be squirmish about our situations, because going to the doctor always feels like you're going to hear a thing that you've never heard before, and just makes you all the more scared to want to even go in. But hey, as always, you can reach out to Dr. Abiola Ajayi on any of his social media platforms. That is Facebook, Instagram, Twitter, even TikTok. Yes, it is ROA Specialist Hospital on all those platforms. But thank you so much, Dr. Abiola Ajayi, for sharing these insights this evening. And I trust that when we reach out again, you'll always be available to give us all that knowledge that we need.
My absolute pleasure. If you invite me, I'll be there.
All right. Thank you so much, and do have yourself a pleasant evening. Lagos, thank you as well for coming through, and thank you for your questions as well, and I'm sure that you have learned a thing or two. Next week, Thursday, we go again. Something interesting for your health, but in the meantime, got the music lined up for you, so don't go nowhere. Stay tuned to Smooth 98.1.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1.
Point one.